participate.
Hello, good evening, and many thanks for joining us again on another fresh edition of your favorite program, the Hilltop Mansion. My name is Kelvin Summer, reporting on duty tonight to bring you a praise of what we have ready for tonight. And in this edition, we will be having live in the studio to discuss and share insight on the gains of the Arise agenda through the Akwa Ibom State Health Insurance Agency. The Executive Secretary, Dr. Igbemi, will be joining us later. For now, let's pause for a break here. Thereafter, we will continue to unveil the many events and happenings within the period under review.
Have you ever missed out on any events or activities of the governor, first lady, or the deputy governor of Akwa Ibom State? Worry no more. Hilltop Mansion got you covered. Hilltop Mansion is a program of the Nigerian Television Authority, NTA, Uyo, specifically designed to showcase the day-to-day activities of the Arise agenda.
Tune in every Monday at 7:30 p.m.
on Star Times, Channel 103, and our social media platforms on Facebook and YouTube to join us. Hilltop Mansion, showcasing the Arise agenda.
Welcome back, and many thanks for staying tuned. Now, let's begin with the World Photographic Day, where Governor himself was a part of it, encouraging the youth of Akwa Ibom State on the need for creativity, assuring them of his regular support.
Initiated by the chief photographer to the governor, the visual conference is part of activities to mark the 2024 World Photography Day and create an opportunity to enhance the capacity of young creative minds in the state to compete favorably in the global space. Speaking at the event, Governor Enowai commended the efforts of the organizers for repositioning photography as an industry that is grooming young men and women in the state, recommends the inclusion of the visual conference into the state's tourism calendar and a creation of photo library in the state.
Tomorrow is here, and because of tomorrow is what you do today. This is a government that is open, and we are prepared to work with our youth to make their ideas and talents find expression. So coming here today is to encourage you. To keep up doing what you're doing, and to encourage every young Akwa Ibomite that you can find expression. Leader has put together this event without asking me for one dime. Again, that's a step of faith. That's risk. She believes in what she's doing. Some people would have said, I sent a memo to your desk, you've not approved it, that's why we're not doing it. And one person that believes that the taste of the pudding is in the eating. If you believe in what you are doing, go ahead and do it. Take that risk, you know. And that's how I was raised.
Remember, the best work isn't about the equipment you use or the techniques you master. It's about the vision you bring to life. It's about daring to see the world differently and having the courage to capture and create what others might overlook. Today, let us challenge ourselves to think bigger, to create with more intention, and to embrace the ever-evolving journey of our craft.
The conference targets to promote and equip 10,000 upcoming indigenous photographers in Akwa Ibom State.
Again, the governor has also received Airbus 22300 series as part of the 10 aircraft paid for by the Akwa Ibom State government for the Ibom Airlines.
This is the second out of the 10 Airbus paid for by the Akwa Ibom State government to help enhance the operations of Ibom Air, an event that stirs excitement among the people who say they are proud to be citizens of the state at this point.
It's only Ibom Air that could deliver an aircraft at a time when the economy is struggling. Starting from tomorrow, we'll plug in this aircraft to join the fleet and expand our schedule, and specifically increase frequencies on the most busy routes in our own network. But this also would help us commence operation into 2 new routes in the last quarter of 2024. It's a good investment. It is a very good investment that all of us will reap the benefit today and tomorrow.
Inaugurating the Airbus, Governor says it's a proof of years of good leadership in the state, assuring that his administration will continue to celebrate every growth and commitment of Ibom Air for making the state proud.
Ibom Air has become Nigeria's most preferred airline, winning awards severally in the aviation industry. In my inaugural speech last year, I promised to honor all financial and operational obligations and to ensure that we continue expanding and supporting this airline, which remains a product of vision. Today, with the delivery of this second Airbus, which we have received to help Ibom Air increase its fleet and routes, I am proud to say that I have kept faith with that promise.
The event features special dedication of the aircraft to God.
In line with the agricultural revolution component of the Arise agenda, His Excellency the Governor has also disclosed plans to inaugurate a food security committee to facilitate its actualization. The Governor was speaking during a professorial chair in soil science in honor of Professor Trenchard Ibia, who recently retired from service.
So probably even though you may be retiring from the university, we're about setting up a food security committee, and I can tell you up front that you'll be a member of that. Because we believe that we need to move our agricultural revolution a step further. We need to begin to have direct contact with our farmers. I want us to be able to, as much as possible, identify farming families.
It is my prayer that the chair that we are talking about now will continue to prosper, will grow from strength to strength, and shall bring forth groundbreaking research and findings that will provide solutions to problems facing soil science and agriculture generally. And on that basis, I stand here to institute and declare the professional chair in honor of our son, a man who has done it all in the area of soil science.
Please celebrate Denzel.
We are having in the studio a man who is in charge of the Akwa Ibom State Health Insurance Agency, who will be bringing us up to date of what the government of Akwa Ibom State so far is doing in this agency. And I'm talking about no other than Dr. Igbemi, the Executive Secretary at Akwa Ibom State Health Insurance Agency. You are welcome to the studio, sir.
Thank you very much. Thank you, listeners. I'm so delighted to be here to talk about health insurance in Akwa Ibom State.
Okay, sir, let's take the bull by the horn. How far so far? After inauguration, the people have been asking, what are those things that are being put in place by the Akwa Ibom State government under this agency?
A lot, if I want to say. A lot has been put in place. But I want to, before I even start, say congratulations to our amiable and workers-friendly governor, His Excellency, Pastor Mo. Congratulations, and may the Lord continue to guide you and bless your tenure in office. Yeah. Now, I'm so particular about that because his coming in has brought in a lot of changes. Okay. I've been in the States. I've worked here for about 20 years. And I want to clearly say this. I've said it again and again. When he came on board, he came with a strategic leadership staff. Okay. A man who knew what he wanted. And he didn't hide it. Came with the Arise agenda. That's the kind of contract with the people of Akwa Ibom State. This government, this is what I have offered to deliver to you. Key into this. Look at it, critique it. Let's make it workable. That was very good. He brought all the parties, brought all structure of persons. I think that was the first I saw it that way. Yes. And I was so impressed. You know, he deliberately also asked that the executive secretary should be part of it. I was invited to be part of that Rise in Jeddah, where I work with the health sector. And from that time, we had something already in place. Okay. And he started walking the talk. What he did was to allow us, first of all, get to know what we are up to. He gave us opportunity to interact with him. He gave us opportunity to also share with him what he can do to make it a success. And we were all excited when he gave approval to so many of the things that we had requested. Some of it even went beyond what we asked for. Okay. We needed a place. He allowed us the space in the State Primary Healthcare Development Agency, the Anchor Insurance House, okay, number 29 Wellington Bassey Way, very close to the government house. So we shared that building with the State Primary Healthcare Development Agency. And for me, that's also a strategic plan, because the State Primary Healthcare Development Agency handles the supply end. Okay. They gave us the facility, look after the staff of the Primary Healthcare Development Agency, and beyond that, the primary healthcare centers. Okay. So they look at the structure, see what they can do to upgrade it and make it good enough for us to use. Now, bringing insurance into that same building, the insurance is the demand end. We place demand on whatever they are doing. And putting these two together for the first time in Akwa Ibom State is a blessing, because the insurance will be working hand in hand with primary healthcare centers to make sure that they deliver what they promise to deliver. Otherwise, we won't pay them. And make sure that they work to encourage, to justify whatever demand they are placing, and we are placing on them. For now, we have staff in all these departments we set up to work with. And indeed, we have to work with the national. The idea of state health insurance was a means of decentralizing NHI, National Health Insurance, so that we can expand the reach for universal health coverage. So there are a lot of things we need to work in harmony with the national. So giving us accommodation qualifies us to be there. The law that was signed in 2021, 1st of December, by the immediate past governor, Mr. Udum Gabriel, was the first step. Then my appointment, that was last year, 1st of February, was the second step. So immediately I was appointed, we got this accommodation, we pulled staff, we now wrote to the federal that we are ready. And that made them get committed. Immediately they got that, they started corresponding with us. I needed to travel to talk with them, which we did. And then they sent in their staff to train our own staff. Okay. That was done at Davok for a whole week for initial startup. That's to get our staff prepared for the work. And that was very beautiful. And it had to work out because of the cordial relationship. And a lot of people don't know that even at the state level, we have the state's NHI. But they don't handle some of the things we're expected to handle, especially the basic healthcare provision fund. Okay. So with that, the initial training of the staff, the commitment of the governor, giving us start-off grant, and again, paying the counterpart fund, okay, which is very necessary. That shows a high level of commitment. In fact, the governor did something that surprised me. There was a certain amount that was actually requested for that particular batch because the counterpart fund comes in different batches. Immediately they release the basic healthcare provision fund. Okay. A percentage of it is supposed to be paid as counterpart by the state to draw it. In that particular disbursement that was done, what we calculated was about 80-something million. But as if he knew, he said, okay, we will go beyond that so that it will also cover part of what was not done and then the next one that was supposed to come. And he gave us 100 million, which we remitted to the national. Okay. And that excited them. They were so happy, so pleased with the governor that he could do that. I can go on and on. A lot has been put in place. We have an ICT platform because data is key. Whatever we're doing at this level, we are supposed to let the national know, we're supposed to let the public know, yes, to a good extent that we're doing the right thing. So we have a very reputable ICT platform that has also helped us to start with the enrollment you were trying to talk about. Yeah. Enrollment has actually started because that is key. We need to be able to enroll the people that will assess the care we'll be providing through the healthcare facilities.
So at this point that we are, which are the class of people that have been enrolled now, or is it for everybody or a sector?
The primary people we are looking for now is the people who benefit from the basic healthcare provision fund. Okay. And then that includes the pregnant women, okay, the children under 5 years, the physically challenged people, elderly people above 60 years, people in prison, people who are displaced. Those are the categories of people we are looking for. But because the program is set up in such a way that as we start with this, we gradually move into this other part. We already have planned to involve everybody.
Okay, now these classes of persons you mentioned who are to be part of this first set,
yes,
how can they get enrolled? You know, at which and how? What are the things that are required?
Yes, for now, the modality of enrollment that we have adopted is facility-based enrollment, where we gather at the primary healthcare or the secondary health facilities and get the people enrolled there. Before we go there, we would have sent out information to the people, town criers, and everybody will come in, just as we've done the correct Benin, the primary operational base there. we've done in Eket Imano General Hospital, where our people join the birthday celebration, free medical activity of the Commissioner for Chieftaincy and Local Government and Chieftaincy Affairs. He was so excited to find our people there. Even on Sunday, our people were there. Saturday, Sunday, they were there enrolling. But we actually started at the polyclinic, the operational base there. And then we had to move there. Why do we choose to follow that modality? Simple. Because we want people to register where they can easily access care. So while they are registering, they are getting to know the place.
Okay.
Because the point of entering to the basic healthcare program is through the primary healthcare facilities. Okay. And because it's actually for the vulnerable, we don't want people to register in a facility that is too far from them. Because even though the medicine is free, and other healthcare will be free for them, if the distance is too far, they might not even have transport to be able to go. That is why we are using that approach. Come register close to where you live so that you can access it. That's the first phase, and we're moving around. And for your information, late April, May, we carried out what is called accreditation.
Okay.
In conjunction with the national. They came for a full-week activity where we visited the primary healthcare facilities. We visited about 100 of them across the local governments, minimum of 4 in each local government, okay. The 31 local government that we have in the state. And out of that was just the first phase. Just last week, we got approval that 80 of our primary healthcare facilities have been given provisional accreditation. Okay. So all the local government have 2 facilities that people can use. And accreditation is in phases. We might have to go again now that we have this. So you can see how far we've gone.
There is no doubt that a lot is being done to kick off.
Yes.
And what has been the turn-up like in all of these places you visited?
The crowd was so massive because the people are excited to be on board everywhere. So, in fact, from today, you will see some people who go to Eket and other places. In fact, some of the places we couldn't put in the first phase because of the pressure from the people, the excitement and the interest, the board had to sit down, reconsider again. Okay, let's make some more funds available so that we can reach out to some of those places. So we're expanding. And if you have not found us yet, relax, we'll be there.
Like you said, on the 19th of September, the launch will take place. That means immediately after the launch, the people will start assessing these facilities in their various locations.
Why do you want to take a word out of my mouth? I won't even surprise you. The plans that we have is that even before the launch, we will pay capitation some of the primary healthcare facilities so that people can actually start assessing care before the launch.
Before the due day.
Yes.
It's all right, sir.
Yes.
Okay, like they always say, to whom much is given, much also is expected. Now, in all of this, the government is doing all of this for the benefit of the people.
Yeah.
What is the role of the people? What should the people do in their own way, as a way of also appreciating and understanding that government really cares for them?
I want to say that our governor, Pastor Umar Basema, has shown leadership. He has been able to put the people together. I will say that again and again. I've been around. Now, I'm saying it based on the facts that are available. People might have their own reason. There was a protest in this country.
Yes.
That involved almost every state. Only a few states. It's not as if people are satisfied with everything that is going on. But he was able to galvanize people. I was there in that meeting when he called the youth at the banquet hall, talked to them, appealed to them, explained to them what they have done, what they intend to do, how they can cooperate. Sometimes The problem we have in leadership is communication. He was able to reach to the people, and I was there. I noticed group by group coming out and say, look, we won't be part of it. We will work with you. We see hope, and we will. So you have a people in Akwa Ibom State that are willing to make sure that the government succeed, because they know, they understand that if the government succeed, it is for them. So the same thing you find when we go out for enrollment. You see people come out in their numbers. And these people, we don't even pay transport for them to come out. It takes something that motivates you, that will make you, spend your money to make sure you are enrolled. So for me, Akwa Ibom people are willing, and I just pray that we'll continue this work, because this is all for our own good. Like this health insurance that is coming up. Government is willing to pay. The governor has demonstrated that by paying the counterpart fund, so that we can comfortably draw what belongs to us from the national. And the national responded, by giving us, disbursing what is due Akwa Ibom State. So with that kind of partnership, the people have a lot to benefit. And we're actually communicating to the people. Just be patient. We are coming.
Most times when government prepares something like this, very good and exciting for the people, there will be others in the system who will be sabotaging this effort by a way, like in a case like this. When I remember when the NIS Federal started newly, you will see that people will go to certain facilities, and to even access this care becomes difficult. And in fact, some of them will even go under an insurance scheme, and still they are forced to pay. So the question is, are there measures to ensure that this does not duplicate itself in the system this time?
Well, what I want to say is that people need to actually understand the contract. And the contract with the people is the benefit package. When you pay, what you are paid, this is what and what you're entitled to. So you need to know the benefit package, what you are paying for, because that is what we sell. Now, if the payment you are paying is not up to setting, you shouldn't demand for that. And the condition is that if you are going to benefit from that, there are some that will tell you, okay, you will pay for certain conditions. You will pay certain percentage, and the insurance will pay certain percentage. Yeah. And you realize that insurance thrives on pool of resources, and then cross-subsidization, where the rich pay for the poor. Those who are well pay for those who are sick, because we assume that not everybody will be sick at the same time. So we work within what we offer to the people, which is the benefit package. And we have different benefit packages. So if you know what you pay for, and they tell you from inception, work with that. Don't go and demand for what. But like the universal health coverage says, we're going to give you, for whatever benefit package we provide, we're going to give you, something that is quality enough, quality enough to make you well.
All right, I believe it's been an interesting time with Dr. Igbemi, who has been the man behind the success stories of Akwa Ibom State Health Insurance Agency. It's been an interesting time within the studio, sir.
Thank you very much.
And we hope that most likely after the launch, we may have to return you here to tell the people more and more of what has been done and the more that needs to be done.
We're available to do that. And, well, I want to tell you that from what you have done, you're actually following what is happening. You are doing a great job. We're launching next month, and you're already engaging us free of charge to come and tell the people what the government have for the people. So this is a very good start. So thank you for giving us this opportunity.
All right, thank you so much, Doctor, for coming.
Thank you.
Well, those are the much you were able to capture on this week's edition of your favorite program. I do hope you join us again next week for another fresh edition. I remain Kelvin Summer, wishing you and yours all the best.